Part B of the Hierarchy of Evidence video series introduces you to some important key players in evidence-based practice. One consideration in the evaluation of evidence is who has produced it and how good their methodologies are. One of the key highly reputed players in Australia is the Joanna Briggs Institute, who collaborate with Australian and international research institutes to produce systematic reviews, and from these, best practice guidelines which are available through their library, JBI Connect. They also produce methodology guides and software to support critical appraisal. The link on this slide is a good one for quick checklists on how to appraise different types of studies as well as systematic reviews and guidelines. Systematic reviews analyse and appraise primary studies on a single medical question, usually aimed at researching a specific intervention for a particular population. This image represents a simplified version of the process. Finding a systematic review on a clinical practice area you are interested in researching can save you a lot of time. A well-structured systematic review will include the databases searched, the search strategies used, and a detailed analysis of studies included in the review, together with their quality and strengths. See this link to our systematic review guide. One of the most robust and trusted producers of systematic reviews is the Cochrane collaboration. Cochrane, like JBI, also work in collaboration with international research bodies to produce systematic reviews. They have a number of specialist resource databases, such as their systematic review database and their database of randomized controlled trials. Like JBI, they also produce and collate methodologies and critical appraisal research tools, which have been collated into a number of handbooks. Clinical practice guidelines are also a synthesis of evidence, but rather than focus on a single medical treatment question or intervention, they often provide a broader overview of conditions and diseases and the range of known causes, prognosis, and treatments. As with all levels of evidence, you do need to approach them with a critical eye. Can you trust the synthesis of the evidence that has been completed? Who has been involved in it, and how recent is it? Is it comprehensive and based on high-level studies or systematic reviews? In providing a comprehensive overview of current best practice, is it compromised, omitting some of the most recent research or complementary approaches? Part B of this video series has introduced you to some of the authoritative organisations involved in evidence-based medical practice and some of the resources they produce.